Well, dear friends, with me is Dr. Akshit Bhardwaj. He got rank 31 in PGI May 2019 exam. Congratulations, Dr. Akshit.
Thank you so much,
So,
sir.
how do you feel now?
Sir, I feel grateful that I have been able to secure such a good rank and I'm sitting here with you and able to celebrate my achievement with you because your institute, especially you, have guided me to secure such a good rank eventually. And it was all your guidance and my motivation from my parents that helped me to secure such a good rank.
Good. So, how did the DBMCI help you?
Sir, DBMCI gave me a comprehensive course. I joined the foundation course, and the foundation course was actually the base on which the whole preparation took place. Then they helped me to build up my concepts and gave me a crux of the notes that was eventually going to be a game changer later on in my preparation series. Then moving on, I came with the DBMCI with the TND. I must say that DBMCI TND is one of the most important things that no student should ever miss because ample amount of time is given to each and every subject, each and every question bank, and it helps us to not only get a main motive that it not only gives us the main environment of the examination, but also helps us to practice the previous year questions in a different format that they help to develop and give us that environment and give us that experience that matters the most.
How are our books?
Sir, I would like to say your books, especially Mini Harrison and Essence, were so helpful to me that they helped me to understand medicine, to practice medicine, and also to apply medicine in my clinicals. And in the final exam also, I could see that some of the questions were direct from that book, and I was so happy that I did your book. And not to forget LMRP. That is a gold standard. You should keep. Means if anyone is doing their internship, I would request him to please keep LMRP with him at all times because you can always brush to the topics, brush to the concepts.
We are coming up with a new edition of LMRP with all latest updates. So that book will be out soon.
Yes, sir.
What about our grand test and your grand test?
Sir, I must say that when I got your app, I was so enthralled that the app gives us not only the question paper of this current year, but I was able to practice the question paper from 2016, 17, 18, and 19. Now, I tell you the advantage of that you can know the trends because each year this institute has catered to the question paper through the needs of that paper, and you can see the trend, and then you can make yourself that how I'm going to approach the paper, what topics I have to give more importance to, and what topics I can leave behind before revision. So those, and I think it's more than 200 tests and I gave around 10 or 15 mock tests of alone of PGI. So I think that was a game changer for me.
What about our vibe?
Vibe is one book that I must say that is a gold standard for image-based questions. I don't think any kid who has done Vibe will ever be afraid of doing image-based question exam because that is the ultimate thing. You can write your notes in it. It's so comprehensive, so concise that anyone, even a final year student can understand very well each and every subject. And direct images, direct ECG images come from it, and even the drugs come from it, and not to mention even revision points are given at the end of the subject and vibe. So that is such means what I can say is the complete thing you can ever get.
I'm sure you must have done our computer lab test, CLTS also.
Yes, sir. I have given you all CLTS in October and December, and I must say that so many students give this test, and you get a good environment by sitting on a computer, getting those 3 hours, and get that feeling. And then after the results come, you can analyze that what topics are weak, what topics are strong, and then you can prepare yourself very well. That is, I think, a litmus test for you that you are going to do well or not, and what you have to improve in yourself.
And you know, we have come with the e-Gurukul also.
Yes, recently sir has started this e-Gurukul app where he has given a lot of videos and explained with everything possible. You know, most of the times in classroom the time is limited and we cannot go through each and every topic. The teachers can miss, it's a human tendency, but these videos are there to help you to cover also those minute points that sometimes they cannot cover due to lack of time. And I must say, please, in the future, I would request all my juniors to see those videos, especially Dr. Mukesh Bhatia sir's video. It will only help you.
We have videos of all faculties, all 19 subjects we have. Most of us we have recorded, but few are about to come. But okay, not only medicine, you should see all other videos also.
Exactly, sir.
Okay. So anyway, my best wishes to you, and any message for the youngster, message?
I would like to say that please don't give up anytime. You know, each and every test, first of all, give all the tests. Please don't run away from any kind of test. Life is a test. Why are you running away from it? And even if you don't perform well, learn from it. Don't give up hope. It's not that hard, but it's only that you have to be dedicated enough to finally crack it. And then you'll get all the happiness that you want.
So my best wishes to you. Wish you all the best. May
Thank you
God
so much,
bless
sir.
you for coming all the way. Thank you very much.
Thank you so much,
Thank
sir.
you very much for watching this video. Thank you very much.